Hey everyone, welcome back to the channel. My name is Aryan Malik. This is Study With Me series, and today is day 26. We'll be continuing talking about fundamentals. This week's topic will be oxygen and airway, and today we'll be talking about the difference between hypoxia versus hypoxemia. Let's get into it. So, hypoxemia is low oxygen levels in blood. So, the body is going to compensate by increasing respirations and heart rate, while on the other hand, hypoxia is a low oxygen supply in the body tissues, and it is a result from uncompensated hypoxemia where the body was unable to adapt and get more oxygen. So the way I see this is hypoxia is a later stage of hypoxemia if unresolved, because hypoxemia is the absence of blood, and if it stays for longer, then that means we don't have enough oxygen in our bloodstream. As a result, not enough oxygen can be transported to the tissues, leading to hypoxia. Let's look at some key points. So for hypoxemia, the PaO2 is less than 80 millimeter mmHg, and now let's look at some early signs. So first, let's talk about brain. When hypoxemia occurs, there will be mental status change. The client will appear to be restless, agitating, or they will look irritable, and they'll also have confusion, which is also an indication of severe stroke or increased intracranial pressure. In terms of vital signs, that will be high, because the body is trying all its means to compensate for the oxygen and make sure that the little oxygen that is left is being transported to the tissues and the areas where it is needed the most. So we'll see an increase in vital signs. So the respiratory rate will be over 20, and it will be tachypnea. The heart rate will be over 100 beats per minute, and it will be tachycardia. The blood pressure will be over 140 systole, which is like the first. So say 140 over 78. So 140, the upper one is called systole. So it will be over 140, and it will be hypertension. And as I said, just to reiterate, as the body scrambles for oxygen, it starts to move the little oxygen it has around the body. That is why vital signs are high, as the body is trying to push around all the oxygen. Now, when it comes to positioning, how will we see the client to be? They will see accessory muscle use. We'll also see paradoxical breathing, and we'll see tripoding, meaning leaning over and trying to get that oxygen. Let's look at some late signs. Their vitals will be low because it is like the body has given up and it is unable to compensate. So here the respiratory rate will be below 12 or bradycardia. The heart, sorry, my apologies, it will be bradypnea. Heart rate will be below 60, meaning bradycardia, and the client will be hypotensive or hypotension. Their skin will turn blue, or in other words, cyanosis, and they will have ECG. Their ECG will show dysarrhythmias. It's like funky heart rhythms as the heart lacks oxygen. Now let's look at a question. Which of the following are early indications that the client is developing hypoxemia? Now, the key word here is early indications. So, the first option is restlessness. Yes, as we know, they'll freak out. It will be a mental status change, which is one of the early signs when hypoxemia, meaning low blood in the bloodstream, occurs. Tachypnea, yes. So tachy meaning increase, and pnea meaning breathing. So their respiratory rate is increasing. It is an early sign as the body is going into fight or flight response. Bradycardia, no, it is a late sign because here the body is not compensating, while in the early signs, body is trying to compensate. Confusion, yes. Mental status change is one of the early signs. And hypertension, yes. High blood pressure, vital signs will be high. So, yes, it is also an early indication. That marks the end of this video. I hope you found it helpful. Please stay tuned for more videos that will be coming out in the future. Thanks for watching.